Okay. All right. Ayan, sige. So we're going to start. So I believe we have stopped here, no? We stopped here sa last natong discussion last Saturday on opportunistic mycosis. All right. And recall, di ba? Last Saturday medyo marami na tayong nachika, no? We have started with myco, the basics, mga fungal structures, and then we also started now with the different types of mycosis, di ba? I have mentioned that in our discussion, our discussion is focused on, or how we go about with our discussion is that we're going to talk about the organisms based on the mycoses na ilang gina-cause. All right? So, based on the mycoses, not on morphology or taxonomy kay medyo confusing. All right? So, we have started now with, of course, superficial, cutaneous, no, subcutaneous, systemic, and of course, opportunistic. So, recall, nasa pangalan na opportunistic, these are mycoses or fungal infections that happen during immunodeficiency or immunosuppression ng mga states, all right? Or when patients have underlying diseases that make, all right, their immune system non-functional or uh, ineffective, okay? All right, so, and these fungal pathogens, again, are opportunists. And then under normal circumstances, again, they are of low virulence, meaning they could not cause disease under normal circumstance. And I have also mentioned that the list of opportunistic fungi have been increasing because again of the prevalence na, the higher prevalence, higher cases, no, increasing number of cases of people having immunodeficiency states, having AIDS, diba, very important, and also other diseases that make their immune system deficient. Hence, a lot of fungi also are becoming more opportunistic or becoming more capable of causing the disease. All right? So again, that's opportunistic mycosis. So daghan natang na-discuss na organisms, no? So we'll start with Phaeohyphomycosis this time. So we have mentioned Phaeohyphomycosis in subcutaneous mycosis. All right? So your Phaeohyphomycosis, diba, is caused by the Dematiaceous molds. When we say Dematiaceous, again, these are molds that have melanin in their cell wall. So meaning they are darkly pigmented. So medyo dark sila in appearance. All right. So Phaeohyphomycosis, nasa pangalan na, di ba? The other name of Dematiaceous kay phioid. All right. So ayan, phioid, hyphomycosis. So sa subcutaneous mycosis na discussion, we talked more on the disease, no? Subcutaneous, so more on lesions, and it's acquired through traumatic implantation of the organism to the skin or to the subcutaneous tissue. But for now, we're going to talk about the organism, all right? Atong lang tawag nilahang morphology. Okay, some of them lumalabas din sa boards and mga exams, all right? So we'll start first with alternaria or alternaria. So we're gonna siya alter account, charot, check lang. Okay, all right. Gonna siya alter, charot. Okay, so alternaria, again, it starts with the sinuses because again, usually this can be inhaled. And in the sinuses, in the immunocompromised, it can disseminate, not to the other parts of the body. All right. Now, for morphology, as you can see, the conidiophores, ayan, are simple, solitary. The conidia, as you can see, is multi-celled, so meaning daghan siyang cells sa sulod. All right. And as you can see, na siya transverse, pataas, longitudinal, na septations, and you have also horizontal. All right. So this characteristic is known as muriform. So when we say muriform, it's evenly distributed or evenly divided. All right. So na siya transverse, longitudinal, na septations, na po siya horizontal. All right. And na siya short beak, ayan, at their apices or nasa tip. All right. Short beak. All right. So again, transverse, longitudinal septations, muriform, multi-celled. All right. And there's a beak at the tip, at the apex. All right. Ayan, all right, sorry. Okay, now for the colonies, it starts as a gray colony, becomes brown, and then becomes black, all right, as it matures. Okay, so that's for alternaria. All right, so again, multi-celled, all right, murashag pan actually, murashag pan sa cafeteria. Okay, ayan, so alternaria. All right, next you have Aureobasidium. So again, Aureobasidium is actually rare in causing diseases, but it can be implicated in mga central venous lines, no, indwelling catheters and all that, and can cause abscesses, can be recovered in blood and also tissues. Now, morphology, take note lang, dears, it has arthroconidia. So we have discussed arthroconidia, di ba? These are conidia that are separated by fragmentation. Okay, so nag-fragment. All right, and the conidia are rectangular or barrel-shaped. Okay, ayan. So that's arthroconidia. please take note. Kinsa na itong mga ni Arthrochonidia, you have Geotrichum, Trichosporon, you also have Coccidioides immitis, di ba? Na siya Arthrochonidia. So take note of that. All right. Now, colonies may be yeast-like, so kato creamy, moist, no, mga bacterial colonies. And again, young cultures become off-white or start as off-white and becomes pink, and they become black with age. All right. So that's for Aureo basidium. Next, you have Chaetomium species. Your Chaetomium species, they have been reported in mga brain abscesses and usually seen in patients that are IV drug abusers. So kato mga tig inject no og drug, mga drugs of abuse, no, inana. All right. So again, that's for Chaetomium. Next, sorry. Iyang morphology, na siya perithesia. All of this is known as the perithesia, and it's pineapple shaped, and na siya hair-like extensions known as setae or setae. All right. Now inside the perithesia is the asci or asci. All right. And inside the asci are the ascospores. All right. So it's lemon shaped. All right. Lemon shaped ascospores inside. All right. Now the colonies again begin dirty gray and become darker with age. All right. Some species may have a pigment that is diffusible or makes the agar completely red. All right. So again, mara siya sea urchin. Charot. Na siya mga buhok-buhok. Ay, okay. Na siya mga buhok-buhok. Okay. Ayan. Hair-like extensions known as setae. All right. Sige. Next, you have your Cladosporium species. Again, starts with sinuses because again, these are inhaled, and then pwede po siyang traumatic inoculation. So it causes superficial or cutaneous infections. Now take note na of Conidia niya, it's spherical to ovoid, and they are in several chains, no? Branching chains, no, from the conidiophore. All right? And wala nakita diri, pero there could be 3 scars resembling a shield, iyahang appearance. Mura siyang shield. Okay? Sana all na shield. Okay, now granular velvety to fluffy and colonies, it can start from olive to brown in color. Okay, so again, branching, all right, branching chains of conidia, all right, in the conidiophores. And then next you have curvularia. Ayan, for curvularia, what you have to take note, good dears, is crescent shape. Okay, so nasa pangalan na, curvularia. So curve siya, all right, it can cause crescent shaped conidia. And at the center, enlarge iyahang cell. Okay, enlarged central cell. All right, so multi-celled, 3 to 5 cells, 1, 2, 3, 4. Ayan, pwede siyang 3 to 5 cells. All right, and the center is enlarged and it's curved, okay, crescent shape. Okay, it may become, again, it causes endocarditis, paranasal sinusitis, and all that. Okay, so pwede siyang mo-disseminate yapon. All right, it's curvularia. All right, and next you have bipolaris. Okay, bipolaris species, take note lang, ang iyahang conidiophore, kaning iyahang stalk, pwedeng zigzag in appearance, as you can see. Yan, zigzag. And aside from that, the imuhang conidia, no? It's poroconidia, so na-mention natin na siya. And it's oblong to cylindric, multi-celled, okay? Multi-celled and distoseptate. So we say distoseptate, dears, it means that the individual cells inside of the conidia, they have their own distinct outer wall. So again, ato na siya i-draw para mas maklaro. Okay. So again, distoseptate. So example, di ba? Oblong cylindric, iyahang conidia. So ang individual cells inside, they have distinct outer wall. So as you can see, the individual cells are separated from each other because nasa lay outer wall yun. Okay? Maklaro yun na separated ang individual cells sa sulod because of their outer wall. And this is known as distoseptate. Okay? All right. And then for colonies, velvety to woolly gyapon, they may become white, then may mong brown, and then olive green to black when they become mature. All right. And lastly, you have Exerohylum. Ayan. Still the same, cylindric iyahang conidia, all right? And as siya hilum, meaning kanina sa base, it's strongly protruding na hilum from the basal cell. And as you can see, muna siya pasabot na distoseptate pod. Ayan. The individual cell, kabantay mo, are really distinct from each other. They are separated or dili sila connected because again, they have outer cell wall good or outer wall na klaro. All right? So that's distoseptate. Okay? All right. So that's all for your Phaeohyphomycosis na organisms. All right? Okay. So before we proceed, any questions so far, dears? It's so hot as in, charot. All right. Okay, nandyan pa ba kayo? Or wala na? Okay pa? Ano sa to?
Pa mi, sir.
Okay, sana all. All right, okay, sige. Any questions, clarifications? Madunggan ako? Okay ra?
Yes, sir.
Okay. So if ma-disconnect ko there's ma-choppy, you know what to do, with that big fat. Charot lang. Okay. All right. Sige, so wala lang. All right, so we'll now continue with the opportunistic mycoses. And now what we're going to focus are the more common ones, all right, and the more important ones, the mga opportunistic mycoses, all right? And we'll start first with your aspergillosis, all right? So aspergillosis, by the name itself, it is caused by, of course, Aspergillus species. Now, your Aspergillus species can be found everywhere, no? It's really common in the environment, okay? And every day we are inhaling its conidia, all right, it's aspergillus because it's in the environment, no? Most of your fungi lagi are in the environment, and every day we are inhaling its conidia and mga reproductive structures. So because thankfully our immune system are working properly, no? They do not establish infection or they do not cause severe mga infections, all right? So aspergillus again is everywhere, all right? But the most common species affecting humans is your Aspergillus fumigatus, all right? And other species, you have Aspergillus flavus, Aspergillus niger, and Aspergillus terreus. All right. Now, in culture, again, these Aspergillus species are molds. Again, they have septate. Okay, septate, na septations or na divisions. Septate hyalin, ayan, hyalin, hyphae. All right. So meaning, dili sila pigmented. All right. Unlike your Dematiaceous molds. All right. So hyalin, septated, or yeah, hyalin, septate, hyphae. All right. Now, it has what we call a conidial head. So this is a conidial head. It consists of the conidiophore. You have the vesicle, the phyalides, all right, and then taas sa phyalides are the conidia. All right. Now, there could be two types of aspergillus. It could be uniseriate or biseriate. So for uniseriate, as you can see, very simple lang ang structure. You have the vesicle, and then attached to the vesicle directly are the phyalides. Okay. Now, the phyalides, ang ihang dala or on top of the phyalides are already the conidia. All right. Whereas for your biseriate, as you can see, na siya additional structure, supporting structure known as your metulae. O, diba? So we have mentioned metulae sa penicillium, diba? So ayan, additional supporting structure. So vesicle muna, and then you have the metulae, supporting structure. And then on top of the metulae are the phyalides, okay? And then on top of the phyalides now are the conidia. So ang difference lang sa uniseriate and biseriate, ang biseriate na ay additional na metulae, which are the supporting structures. Okay? So uniseriate or biseriate imuhang aspergillus. All right. Okay, sige. Yan. So here's the picture. As you can see, uniseriate, the vesicle, all right? And then diretso dahil mga phyalides, and then finally the conidia. Whereas for the biseriate, as you can see, you have the vesicle, and then the metulae, which is the supporting structure, and then the okay, weird, sorry. Phyalides, okay, and then finally the conidia. All right, okay. I hope na gets lang to siya. All right. So that's for uniseriate versus biseriate na aspergillus. Okay? All right. Now in culture, in tissue, sorry. In tissue naman, they are seen as hyphae lang. So mga hyphal fragments sa imuhang aspergillus ang makita. And usually their orientation or distribution is similar to a tree, no? Tree-like or dichotomous na mga branches. Ayan, as you can see, di ba? And they're arising at acute angles, no? Acute angles, 45 degrees, no? As you can see, nag-bend sila, no? At 45 degrees. So acute angles, dichotomous tree-like branches, no? That is your aspergillus in tissue. And true enough, if you see no hyphal fragments from tissue, no, it's mostly attributed to aspergillus. Pero daghan pang other fungi na possible na may mga hyphal fragments or hyphae sa tissue, but most of the time that is from aspergillus. Okay? All right. Now again, tree-like, dichotomous, acute branches. Okay? Acute. Sana all acute. Shut up. Okay. Now for Aspergillus terreus, very specific na species, iyahang appearance in tissue, ang iyang hyphae na ay aliroconidia or na conidia sa kilid sa hyphae. Alright? The rest of your Aspergillus species, walay and ani. Alright? So the rest of your Aspergillus species are indistinguishable in tissue. But for A. terreus, it has aliroconidia, which is specific for A. terreus. So if makita ka ginani sa imuhang tissue sample, biopsy, na stain mo siya, then that is diagnostic diagnostic for Aspergillus terreus. But if wala kakitaan ni kanilang, inani lang, then that could be other Aspergillus species. All right? Okay. So that's for the morphology in tissue of your Aspergillus. All right. Okay. Now we go now to the disease. For clinical syndromes of Aspergillus, again, it has three types, no, or three different clinical settings. Number one is, of course, opportunistic mycoses. Number two is allergic reactions or allergic states, and finally, toxicosis. All right. Now, among all the filamentous fungi, no, tanan-tanang molds, Aspergillus yun ang pinaka-common to cause invasive infections. So it's second to Candida to be retrieved, no, from samples sa mga opportunistic pathogens. All right. Now, almost any organ system can be involved in aspergillosis. Samot na if mo invade siya. So from the eyes to the feet, no, to the brain, to the heart, pwede yun siya. All right. So again, all commonly seen sa mga immunocompromised patients because again, their immune system is not functioning properly. Possible ginadili nila makayang ma-fend off ilahang self against aspergillus. All right. Okay. Now, for the disease, again, of course, it starts with the lungs because, again, we inhale, no? This is acquired from inhalation of the conidia of Aspergillus. So your Aspergillus, it starts as primary pulmonary aspergillosis, all right? So it may resemble pneumonia and other lung diseases. For chronic aspergillosis, it can cause masses, no, secondary to other diseases such as tuberculosis or sarcoidosis. All right. Now, farmer's lung disease, nako, press the buzzer agad-agad. This is a hypersensitivity pneumonitis. It's a disease, no, allergic reaction of farmers, especially, or humans to Aspergillus antigens. So na ay eosinophilic infiltrate sa lungs, no? So hypersensitivity pneumonitis. So common ang mga farmers because again, your farmers are prone, no, to the soil. Siging work sa soil or sa mga plants. So higher chances of inhaling the Aspergillus antigens. Okay? So kung farmer's lung disease gani, farmer's lung disease, nako, agad-agad, that is your Aspergillus. Okay? And another one is your Aspergilloma, your fungus ball. So by the name itself, it's a mass, no? It's a conglomerate. So nagkumpul-kumpul na mga hyphae of Aspergillus, mucus from the body and all that, and they usually reside within cavities, no? So kanang nanay halo, no, sa imuhang organs such as sa lungs, secondary to tuberculosis, or sa mga sinuses, kay cavity man na siya, like empty space, all right? So they create fungus ball. Aspergilloma, again, fungus ball, conglomerate, kumpul-kumpul of hyphae, mucus, and all that. All right. Now, Aspergillus terreus was also discovered to be the true cause of aspergillemia, meaning siya gyud ang species na capable of being spread sa blood or muspread sa blood. All right. Okay. And of course, last one, Aspergillus species also produce mycotoxins. All right. So nasa pangalan na, these are toxins, no, poisonous substances released by fungi and usually makontaminate atong food ana, and that is where we get the toxin. All right. So by the name itself, toxin. And a very good example is of course aflatoxin. I'm sure you're familiar with that. And usually, di ba, makuha nato na siya from peanuts. Ayan, mga mani, okay? Peanuts, all right? And usually chronic exposure, chronic ingestion of peanuts that may contain aflatoxin gives us a higher risk of developing hepatocellular carcinoma, all right? Hepatic cancer, okay? In the long run, kung chronic, siging exposed to aflatoxin. All right? So that's the last topic for today, ang atong mga mycotoxins later. All right? Okay, so that's for Aspergillus. So daghan siyang clinical states, no? Pwedeng sa lungs, dissemination, and also toxicosis. All right, okay. Now for Lab DX, of course, the best method good is isolation from the site or from the specimen, all right? And we culture, all right? And this organism grows well in routine mycologic media lacking cycloheximide. So when we go to the different culture media in mycology, I think next Monday na, we'll then discuss na naay mga media of fungi na walay cycloheximide. Na po yung ba na naay cycloheximide? Because cycloheximide can inhibit a lot of fungi, all right? So na yung mga media na dapat na yung mga media na dapat wala. Depending on the species that we want to recover, okay? All right, ayan. Now, species level identification, we then look at cultural, mga colony morphology, and also their microscopic morphology. So we look at the arrangement of the conidial head, no? Kung uniseriate ba siya, biseriate ba siya, unsay appearance, unsay arrangement sa yung conidia, sa yung phyalides, atong lantawon for identification. All right. Now, culture colors can range from a lot of color, no? And a granular texture can be seen in some species. All right. Now, gold standard for diagnosis of invasive aspergillosis is isolation of the organism from culture and histological examination. So if maka-isolate ka sa culture and then positive ka siya biopsy, then that is the gold standard for diagnosis. And for rapid diagnosis of invasive aspergillosis, we use immunodiagnostic methods. And we detect unsa na antigen, galactomannan antigen in the serum, okay, of patients suspected of having invasive aspergillosis. All right? So immunoassays, detection of galactomannan antigen. All right, so that's for your aspergillosis, the first of the more important na mga opportunistic infections. Okay, all right. So that's for aspergillosis. Again, what you have to remember lang, aspergillus, fungus ball, kanang yun ang mga keywords. Farmers lang, nako, press the buzzer. And then unsa pa man, you also have aflatoxin, nako, ayan, press the buzzer. Muna siya mga keywords for aspergillus. Basin mo gawa sa mga case studies, so at least agad-agad. All right? Okay, ayan. So before proceed to Candida, any questions so far, dears? Okay, napakainit talaga. All right. Okay, sige. All right. Carry pa. Okay. All right.
Yes, sir.
Sige. Okay. All right. So we continue with the next pathogen, your Candida species. So your Candida species, again, these are yeasts. All right. Dili sila no, charot. Yeasts. Okay, they are yeasts, and they're considered to be the most important group of opportunistic fungal pathogens. Okay, so siya good, no? Siya good ang pinaka-important. Sana all. All right? Sana all important. Okay. And yes, my question. Okay. Sorry, Mer. All right. Okay. So most important group of the fungal pathogens, opportunistic, your Candida species. And among the Candida species, the most commonly recognized species is your Candida albicans, of course. Your Candida species are normal flora of the body, okay? And usually they reside, majority of them, they are found in the GI tract, no, from the mouth up to the rectum. But they can also be seen in your skin, your mucous membranes, your vagina, all right, and other areas, especially sa skin. Now, usually when the body's immune system is down, all right, and the barriers are weakened, then dito na mo cause of infection ang Candida. All right, that's endogenous, no? Endogenous meaning gikan gyud mismo nimo. Pwede po siyang exogenous, meaning direct contact from a patient or from a person that has Candida. All right, but again, they're usually opportunistic, meaning they only cause infection talaga if your immune system is down or it's weakened. All right, now some of the diseases that are risk factors for having candidiasis, you have diabetes, immunosuppressive disease or therapy such as magtambal kag mga immunosuppressants. You also have neutropenia as a result of disease such as AIDS and mga chemotherapy po na mga tambal na makapa-weaken sa imong immune system. All right. Bloodstream infections, fungal endocarditis happens if we use mga indwelling vascular lines, no, such as mga kanang mga catheters and all that. If contaminated siya with Candida, then possible na dito makuha ang infection. All right? So common in mga hospitalized patients, mga nosocomial infections. All right. Now for morphology, for all species, they have blastoconidia. Ayan, the budding cell, all right? Budding yeast, yes, mga blastoconidia. They also have pseudohyphae and true hyphae, except for Candida glabrata. So among the species of Candida, Candida glabrata ang walay pseudohyphae and true hyphae. All right. Also, the culture is smooth, white, creamy, and domed colonies. So, mara siyang bacterial colonies yun. Your yeast colonies, actually, they look like bacterial colonies yun. So, sometimes they should siya ma-differentiate. All right. But again, if you gram stain or examine under the microscope sa colony, makita na dayon if yeast ba siya or bacteria. All right. Now, C. albicans and other species, they exhibit this what we call phenotypic switching, meaning pwede silang mo switch from the dome, creamy, white colonies to the fuzzy colony or cottony na mga colonies. So, depende. And it's believed that through this phenotypic switching, pwede silang makasurvive in different areas, no, in the body, different areas in the environment. Kaya kabalo silang mo adapt, no, sa environment depending kung unsa na environment ang naa sila. All right? So, mo switch sila from being katong iyahang common na yeast colonies such as kanang white, creamy colonies, mahimo siyang katong fuzzy, cottony na mga colonies. All right? And that's for phenotypic switching. Ayan. And here again is our morphology. No, these are the colonies. As you can see, mura siya bacterial colony, but usually mas dagko siya compared to bacteria. And then, as you can see, you also have the pseudohyphae. We have discussed. We have discussed this. No, pseudohyphae lang. Again, it's from the budding cell, and then nag-elongate siya, And as you can see, daghang mga budding pod sa kilid, all right? Whereas ang true hyphae, ano gid siya, vertical, no, straight lang yun, all right? Wala yung mga constrictions. Ang imuhang pseudo hyphae, as you can see, na yung mga constrictions. Ayan, may mga constrictions sa iyahang side or sa wall. But for your imuhang sani, hyphae, straight lang gid siya. Smooth ra yung appearance, diretso lang. All right? Okay, so that's for pseudo hyphae and true hyphae. Okay. Now we go now to the diseases caused by Candida. Now for Candida, again, it causes a wide range of disease, starting first with your cutaneous. No? So sa skin, it can cause rash, no? Erythematous lesions, and may also have a creamy white exudate or scaling. So pwede siyang magduga, no? Creamy or may mga scales. So erythematous, no, or mag-red imuhang rash. Very important disease is the diaper rash. Nako kana gyud basta diaper rash agad-agad, no. One of the diseases or one of the pathogens there is Candida. So diaper rash seen in infants from wearing diapers, okay? And in adults, kay intertrigo sa mga skin folds, so in between sa fingers or sa toenails, sa mga toes, toenails, sa toes, all right? And another is areas common affected by cutaneous mycosis, cutaneous candidiasis. You have the groin, in between fingers and toes, under the female breast, and axilla or armpit. So usually, ganun sila mga moist, mga areas. Kani sila ng mga areas medyo moist, no? Magbasa-basa. Ayan. So ganun silang basa. Okay? Marag ako na dili basa. Charot, check. Joke, basa dahil ko ang gisingot ko. Anyway, all right. Now, another one is when workers are constantly immersing their fingers or toes in water, it can lead them to onychomycosis. No? So infection of the nails, or infection of the nail beds, paronychomycosis. Paronychomycosis. All right? So infection of the nails pwede onychomycosis, or kani infection sa muhang nail bed, paronychomycosis. All right? So that's for cutaneous. More on rash, no? Rashes, and also erythematous lesions, and aside from that, pwedeng ma-infect po ang nails. All right. Okay. Now another one is of course oral. Ayan. Oral candidiasis or moniliasis. Very, very press the buzzer na agad. It causes the very popular, no, thrush. Okay. Big word, no, thrush. Okay. Don't leave your thrush anywhere. Charot. Okay. Pakihaha. Charot lang. Tsaka lang. Okay. All right. So ilahang manifestation sa imuhang mouth na ay creamy white patches. All right. And it's described as white cottage cheese. Ayan. So muna siyang cheese or white stuff on the mouth. Okay. So nigawa sa board, kaning white stuff on the mouth, no? It is described as white stuff on the mouth. So ang answer na kay thrush. Okay? So baka may maibang white stuff pa sa mouth niyo. Baka hindi na yan thrush. Baka ano na, mga ano. Okay, basta white stuff on the mouth, atong answer kay candidiasis. Okay, sana all may white stuff sa mouth. Charot lang. Okay, all right. So again, muna siya nigawa sa boards, ha? White stuff on the mouth, atong answer is thrush. Okay, if wala thrush, ang answer kay candidiasis. All right. And thrush is an indicator of immunosuppression. So one of the early signs good that you're immunosuppressed or you're immunodeficient is you having thrush. Okay? All right. So mga thrush issues. Charot lang. Check lang. Okay. Now, in heavy infections, kanimuhang patches, pwede siyang mufikin, mubaga. Alright? And because baga siya, it could lead to difficulty in swallowing, no? Dysphagia. Alright? And aside from that, again, oral candidiasis is one of the early signs good of HIV infection, or pwede po one of the early signs of immunosuppression. So if makakita kag thrush in someone, it could possibly mean that their immune system is slowly getting weaker or deteriorating. Alright? So that's for thrush. Okay? White stuff on the mouth, white cottage cheese-like patches on the mouth. Okay? Thrush issues, charot. Okay, so that's for oral candidiasis. Basos ko talaga, no, pasensya, sorry. May mga nare-remember kasi ako, charot. Charot. Okay, ayan, okay. Sige, that's for thrush. So, dears ha, so same magyapon. From the start, I have emphasized already, you have to examine your specimen. So, examine your partners. Okay, be careful. Alright, lang tawag yun ang mouth, lang tawag ang middle, lang tawag po ng ilalong. Okay, so, examine your specimen. Medtex kayo, magaling kayo dyan. Mag-examine ng specimen. Okay? Alright, sige. So that's for oral candidiasis. Ako, Mark, my God. My mind talaga. Charot. Okay. Next, you have gastrointestinal candidiasis. No? So, by the name itself, GI, imuhang GI tract na affected. So as you can see na yung mga patches na sa surface of your GI tract. Most of the time, it affects the esophagus. No, it presents as esophagitis. All right, and there could be erosive lesions, which result in pain, no, substernal pain. Next, your vaginal candidiasis. Of course, vaginal candidiasis, it leads to still the same, kani siya, curd-like, no? Meron siya ka ng pinagahi na curd is parang the stage before the cheese, no? So curd, no, medyo gahi, alright? Si Curd Halandoni, charot lang. Akong batchmate, charot. Okay, curd-like, ayan. It could lead to vaginal burning and itching. Kaya mag-discharge siya and katul ni siyang curd-like discharge. So vaginal burning and itching, alright? And yeah, so it could be acute or chronic infection. Okay, ayan. So again, vaginal candidiasis. All right. Okay. Next, your UTI, urinary tract infection. Of course, your yeast can cause infection. Pero there could be a difficulty in identifying if it's the yeast causing the UTI or dili. Because again, your yeast, your candida, is a normal flora of the urinary tract. So possibly lang na contamination, all right, or it's really the one causing disease. So you have to look at patient history, no, kung unsa ba yung mga underlying diseases sa imong patient that could be attributed to that. Pero if wala manggani, if dili ra immunosuppressed ang patient, then na siya mga yeast cells, possibly contamination lang or dugay na ang sample, no? Kaya ni proliferate ang mga yeast, okay? All right. Now, severe infection, it could involve the renal papillae, so na necrosis, mamatay mo ang kidney tissue. All right. Pero in CM and AUBF, basta makakita ganitag yeast cells sa atohang urine, nagitay usa ka disease, no? One of the many diseases na pwede natong ma-correlate with the presence of yeast cells sa urine. Unsa man to siya na disease? Nako, AUBF. Magkakaalaman na. Charot. Once man to na disease, basta na ay presence of yeast cells sa urine, daghang yeast cells, one of the diseases na atong pwedeng ma-think about is this.
Sir,
no?
katong caused by katong vaginalis ba na siya, sir?
T. vaginalis ba? Yun ba?
Trichomoniasis?
Trichomoniasis ba? Okay. Sige. Napailang mo answer? Thank you, Marcos. Okay.
Diabetes, sir.
Diabetes? Kinsa ni answer ani? Who are you? Mapakilala ka. Kinsa di? Kinsa ni answer ato?
Ron, sir.
Ron. Okay, all right. Final answer, Ron. Tama ba? Diabetes ba? All right. Sige, diabetes ang sabi ni Ron. Napailang mo answer?
Clue, sir. Clue.
Urethritis.
Ano to?
Urethritis.
Urethritis. Pwede din. Okay, sige. Napailang mo answer?
Alright. Clue, sir.
Candidiasis.
Unsa to? Candidiasis. All right. So actually, na-mention ang tama na sagot, no? And the correct answer is diabetes, no? Thank you, Ron. Magaling. That is good. So one of the diseases na pwede na ito makorelate or one of the expected results sa urine of a patient with diabetes, if intense na gyud, is the presence of daghang yeast cells. Why? Because, di ba, na-mention sa start sa atong discussion sa Candida, diabetes is a predisposing factor for candidiasis. Why? Because your Candida albicans love glucose. Alright? Ganan siya sa glucose. So, kung imuhang urine taas kay glucose, so meaning mas mo proliferate siya. So, if ikaw mo practice in the medtech field pohon, or in your internship, makakita mo daghang yeast cells good sa urine, then one of the first steps na imong lantawon is, or one of the next step na imong buhaton is, to check for glucose sa urine. Lantawon imong chemical exam niya. Unsa may chemical exam niya? Is it nabad siya glucose or wala? Alright? If wala ra, normal ra yung glucose, and possibly na underlying disease. Alright? Ayan. Most often, good based on experience, but sa daghang yeast cells, pag ako lang tawon ng glucose sa chemical exam, taas gyud, 3+, 4+ gyud, inana siya. Okay? So, diba? One of the correlations. Because again, your yeast cells, your Candida albicans especially, they love glucose. Okay? So, mas mo proliferate sila sa glucose environment. Okay? So, sa urine, nataas og glucose in diabetic patients or hyperglycemia man, then, again, it can lead to the prevalence of yeast cells in your urine. Okay, so take note of that. So thank you, Ron. Magaling, diabetes. Okay, all right. And of course, invasive candidiasis, it can lead to dissemination. Okay, commonly seen in immunocompromised patients. All right, and Candida gyud is one of the organisms that are commonly recovered from blood cultures. So take note of that. Mga blood cultures gyud, dili gyud, it's not uncommon. No, it's not uncommon to recover Candida from the blood. So in your internship pohon, if ma-rotate mo sa micro, na may makita dito ng mga machines, no, for blood culture, mga BACTEC, BACT-alert, ayan. And usually good one of the organisms na common good na ma-recover kay yeast. Okay, yeast, no, Candida usually. All right? So it's not uncommon to recover Candida from blood. All right. And candidemia is again the presence of your Candida sa blood. All right? Hematogenous spread of the yeast to one or more organs. Okay. All right. Now for lab DX, of course, we examine the clinical material. Appropriate clinical material, is it kung cutaneous infection, so sa skin, blood kung invasive, no, etc. All right. Next, you could also put subject the scrapings of your skin, cutaneous lesions to KOH preparation, of course, and then we examine that, or we can add calcofluor white, okay, to examine the fungal hyphae and fungal structures. Next, of course, tissue specimens and other specimens can be cultured using culture media, all right, again, with and without cycloheximide. All right. And for culture, if we can see mga feet na mga extensions, no, filamentous extensions na murag feet sa colony, that indicates the presence of pseudohypha and hyphal na mga forms. Okay? All right. So here's an example, di ba? Kaning mga nadiri, mga murag filamentous extension, murag tiil, no, feet extensions. All right. Ayan. And for histological staining sa tissues, medyo dili maklaro ang Candida sa ubang mga stains such as HNE, periodic acid shift, Gomori, methenamine silver, and gridleaf fungus stains. So sa tissue, medyo di siya klaro ng mga stains. But in gram staining deers, as in very common gid kayo ang yeast, no? Mas stain good sila by gram stain and they are gram positive, okay? Because they are higher organisms, so gram positive sila. Okay? Common gina siyang ma-recover from clinical specimens pag gram stain. Okay? Alright, ayan. Next, you have your cornmeal twin 80 agar morphology. So, this is another, one of the most important tests pod for Candida. We look at the different morphological structures produced by Candida in cornmeal twin 80 agar. So, this is a culture media. So, for Candida albicans, ang atong lantawon is the production of chlamydospores. Ayan, this one. So, kani mga spores, di ba? Terminal sa hypha or intercaliary. So we then look for the production of chlamydoconidia or chlamydospores. We look for pseudohypha, if naaba, blastoconidia, arthroconidia. And usually, kato ng mga morphology, they can identify the species already. So for Candida albicans, we look at chlamydoconidia. All right? And if negative po ang germ tube nimo, then of course, we can look at cornmeal twin 80 agar. Okay? Because again, morphological features of your Candida can already give you definitive identification. All right? Or even presumptive pala, sorry, presumptive identification. All right? Cornmeal twin 80 agar morphology. Next is of course the germ tube test. Your germ tube test is the most important good, no? The easiest and the really most important test good for yeast identification. Not only Candida, but also other yeasts. Because yung makakita ka yeast sa imong sample, pag subject nimo germ tube, if positive ang germ tube siya, no, if positive siya germ tube, then most of the time that is Candida albicans. Kung negative, the rest of the yeast na siya, na clinically important. Okay? So kung positive siya germ tube, pwede siyang C. albicans, pwede po siyang Candida dubliniensis. Pero majority yun is Candida albicans. So pag germ tube pa lang nimo, positive na siya, then you are already safe to say na that's Candida albicans or Candida dubliniensis. Alright? And if dili pa gid siya klaro sa germ tube, pwede na ka mag cornmeal twin 80. Ayan. So from germ tube, cornmeal twin 80 ka, agar morphology. Okay? So germ tube yun ang pinakauna, and then followed by cornmeal twin 80 agar. Alright? Okay, so for germ tube, as you can see, hyphae-like extensions from the mother cell. Alright? Or from young yeast cells. But ang difference lang, as you can see, walay constriction. Alright? Wala siya ni constrict at the base kung asa siya gikan. Alright? So this is the germ tube and this is the pseudo germ tube. So na constriction. Alright? And also your pseudohyphae, as you can see, na mga septation and apoy constriction. Basta ang pinaka-important characteristic yun sa germ tube deers, wala siya constriction sa base. Okay? Please take note of that. So no constriction at the base, that is the germ tube. Okay? And if naa ang organism ana, then the organism is positive for germ tube. Okay? Alright. And again, kinsa itong duha ka positive, Candida albicans, Candida dubliniensis. So to differentiate the two, naray mga additional tests. Okay? So mayroon siyang backteg yun, no? Na mga biochem, no? And further tests to really identify the species. Okay. Alright. Next, you have the difference between your Candida tropicalis and Candida pseudotropicalis. So for blastoconidia, arrangement lang nila, as you can see, ay muhang Candida tropicalis, the blastoconidia is along the hypha, na siya sa kilid, along, alright? And for your pseudotropicalis, parallel clusters. So nag-cluster sila, kumpul-kumpul, alright? Parallel clusters. Ayan, parallel clusters. Parallel clusters. Okay? All right. So that's for Candida pseudotropicalis and Candida tropicalis. All right. Another test is your carbohydrate assimilation fermentation test. So your carbohydrate assimilation fermentation test, nasa pangalan na, we detect the ability of the yeast no to use the carbohydrate depending on unsa na carbohydrate. So muna siyang third test na to i-perform after cornmeal twin 80. So ang pinakauna di ba germ tube. So sa germ tube pa lang daan, kung positive C. albicans, kung negative other yeasts. So if di pa siya pun klaro, go to cornmeal twin 80 agar. Okay? Look for the morphology. If di pa gyud Japon klaro, we then perform carbohydrate assimilation or fermentation test. Okay? And from there, ma-speciate na nato sila, especially the Candida species. All right? Based on their ability to use the different carbohydrates or sugars. All right. Next is another very easy and convenient pod na test or culture media, your chrome agar Candida. So similar na siya sa chrome agar sa bacte. By the name itself, no, ang culture media itself daghang substrate, okay? And depending on the different enzymes specific to a particular species, no, mo produce like different colors, okay? Depending on the substrate na ilahang gigamit, all right, and the enzyme present, all right? So we identify them based on color, all right, and colony morphology, no? Especially color gyud. So nasa pangalan na, chrome agar chromogenic. We base on the color of the colonies. So here's an example. No, for C. albicans, it's color green yun yung colonies. All right. For C. tropicalis, kay metallic blue. For C. cruce, kay light rose to pink with a whitish border. And the rest of your Candida species, pwedeng cream, no, or rose, or light to dark mauve or purple, no. Ina na yung color. Okay. So take note lang. C. albicans green. C. tropicalis kay blue. All right. C. cruce kay light rose to pink with a whitish border. So here's an example. Ayan. So green, imuhang Candida albicans. Your tropicalis is metallic blue. Nice kayong color. No, I love that. C. cruce is light rose to pink. Ayan. And the other species of Candida, they are cream colored or pwede siyang mo purple, light to dark mauve or light to dark purple. Okay? So take note lang. C. albicans green, tropicalis blue, cruce kay pink. So muna siya mga expected colonies sa chrome agar, Candida. All right? Okay. And the remaining tests na lang, you have rapid tree hallows test, no? For rapid tree hallows test, this is primarily used for Candida glabrata because your Candida glabrata is really known to utilize the sugar tree hallows. All right? So tree hallows, ayan. So negative nimo is blue or green, positive ang yellow. So it's because of the change in the pH indicator. Okay? So ni change ang pH indicator kay gigamit sa yeast ang imuhang sugar. So na mga byproducts that change the pH of the solution, okay, na trigger ang change sa color, okay? Ayan, so that's for rapid tree hallows test, again for Candida glabrata. Of course, you can use molecular methods, but it could be time-consuming and expensive, all right? Pero pwede yun siya. Mas accurate, mas specific. And of course, we can use also commercially available phenotypic identification systems, mga machines ni Shadirst, all right? Such as the API 20C AUX and Vitek 2 YSD cards. So take note of the Vitek, ha? We'll discuss these machines later towards the end of Myco. Pero kaning Vitek yun, very important. Muna siya one of the machines na ginagamit po sa micro sa imuhang hospitals, okay? Because the Vitek machine can already identify your bacteria and also perform antimicrobial susceptibility testing, AST, no? And it's really effective and convenient, no? Daghan jud siya. It's primarily used for bacteria, pero aside from bacteria, pwede po siya mogamit or maka-identify og yeasts. Okay? So take note of that. Okay? May encounter ninyo sa internship, promise, as in. All right, okay. Now, just some notes about the different Candida species, starting first with Candida albicans. Your Candida albicans, again, is the premier cause of yeast infection in the world. So, siya gyud ang pinaka-common na makakause of yeast infection in the world, o, diba? Aside from that, again, it forms germ tubes and chlamydoconidia. So, we look at chlamydoconidia, germ tubes, no, pseudohyphae, cornmeal twin 80 agar. Ayan. Now, it's capable, again, of phenotypic switching, and because filamentous ihang form, it can embed, no? Pwede na yung mga ubang pathogenic organisms na mutapot sa filament, such as Staphylococcus aureus, which can aggravate the disease and can form biofilm. So, mas mo intensify noon ang disease. All right? That's for Candida albicans. Next, your Candida glabrata. It's the second most commonly isolated Candida species. Again, very important characteristic, wala siya pseudohyphae, wala po siya germ tube, and wala siya true hypha. So, ang nara niya basin blastoconidia ra. Okay? So, again, wala siya germ tube, wala pseudohyphae, wala true hyphae. All right, ayan. And infections tend to be more aggressive in patients with comorbidities. And lastly, your Candida auris, take note, newly discovered species ni siya of Candida. It's an emerging multi-drug resistant, ayan, MDR, multi-drug resistant na Candida species, and usually seen in mga hospital settings, nursery settings, no, in the mga medical settings, institutions, all right? And they are usually transferred from patient to patient or patient to healthcare worker. So very important. Ang hands sa healthcare worker ang one of the ways para ma-transmit ni siya. So be careful, good. No? So again, multi-drug resistant, wala siya pseudohyphae, but it can form biofilms, all right? And it can be misidentified as several other yeast species. So again, no, emerging multi-drug resistant na Candida species, Candida auris. Okay, all right. Now, just the results lang of carbohydrate assimilation and carbohydrate fermentation. So you may be thinking, certainly difference, no? Ang carbohydrate assimilation, dears, nasa pangalan na, it's just testing the ability of the yeast to use a particular carbohydrate as the sole source of carbon, okay, in the presence of oxygen. So just to take note lang, if mo-grow ba siya in the presence of this sugar. So ang test aning assimilation kay na ay agar, all right, and then imong inoculate ang sample or imong organism, and then magbutang kag discs of this sugar. And then imong lantawon if na growth around the disc. If na growth, it means mugamit siya ato na sugar. Okay? So it's using sugar lang yun. As the source of carbon in the presence of oxygen. Whereas for fermentation, ang fermentation na sa pangalan na, same sa bacte, no? It uses sugar or your carbohydrate and it ferments, no, in the absence of oxygen and produces byproducts of fermentation such as gas, alcohol, diba? So that's why ang positive reaction is of course gas production diri. Okay? Ayan. And as you can see, bahalag kinsa na Candida species, ganahan jud sila og glucose. Positive gyud sila og glucose. Example lang aning C-rugosa. So as you can see, ganahan siya glucose. That is why in the urine of patients with diabetes, ayan, possible ginadaghang yeast because of the high concentration of glucose. O, diba? Ayan. So, very consistent lang din naman sa biochem sa Candida. Okay? Alright. So, ganahan siya glucose. Ayan. Okay. So, that's all for Candida species. Ayan. Before I proceed, any questions so far, dears? Again, kisa tong naaga ni characteristic mariner's wheel, pilot wheel, iyahang yeast cells, Mickey Mouse, no, to the cap. You have, isa man to, mariner's wheel. Press the buzzer na dapat, agad-agad. Medyo mabagal. Okay, isa man to, mariner's wheel. Yes, kaya yan. Para
Paracoccidioides.
Brasiliensis.
yan. Press the buzzer agad-agad. P. brasiliensis or Paracoccidioides brasiliensis. All right. Broad base, okay, broad base, broad isthmus, iyahang appearance sa yeast. So na siya budding yeast, then broad ang isthmus or bridge, and broad ang ilalom na yeast cell. Broad base, this is letter B pod.
Blastomyces.
Diba?
Dermatitis.
Okay, agad-agad dapat. Blastomyces dermatitidis. Okay, very good. All right, so we now continue with your opportunistic mycosis with Cryptococcosis. So your Cryptococcosis is of course caused by Cryptococcus species, all right? And it's one of the most important din ng mga opportunistic pathogens and one of the most important causes of meningitis. Ayan, meningitis, pulmonary disease, and septicemia. So kinsa man itong mga species na mga cause sa Cryptococcosis, you have Cryptococcus neoformans and Cryptococcus gatii or gatii. Excuse me, sorry. All right. Now your C. neoformans, it has a lot of varieties. It could be C. neoformans variant grubii or C. neoformans variant neoformans. So ato na siyang collectively call as C. neoformans. All right. Now for morphology, very important, dears, it has a capsule. Encapsulated siya, all right? Oval to spheric in shape. All right. Replication is by budding. And as you can see, narrow base lang siya. So, in contrast to blastomyces na broad base, narrow base or niwang lang ang ilalom sa imuhang Cryptococcus. Alright. Now, single buds are usually formed. There could be multiple buds and chains of budding cells. Now, take note, in cornmeal twin 80 agar, blastoconidia ang naa. Inanira, blastoconidia ang naa. Wala'y pseudo-hyphae, wala po'y true hyphae on cornmeal agar. Take note, blastoconidia ra. Alright? So if na mga case study produces blastoconidia only in cornmeal twin 80 agar, press the buzzer, that is your Cryptococcus species. Okay? Alright, so that's for Cryptococcus neoformans and Cryptococcus gatii. Alright. Now for clinical syndromes, as you can see, the most important disease presentation good is in the brain. Pero it starts with the lungs. Alright? Okay, it's still pulmonary. We inhale. Alright? We inhale the spores from the soil. Alright? And especially if ang soil kay enriched with pigeon droppings. Ayan, take note there. Siya ang pigeon droppings. No? So nasayop ko sa Coccidioides immitis. Pasensya. So mo siya itong correction. Ma-confuse mo ko sa Coccidioides o Cryptococcus. Sorry. But for Cryptococcus neoformans to siya dear, Cryptococcus species enriched with pigeon droppings ang imuhang soil. So mas mo facilitate, mas mo overgrow or mas mo grow ang imuhang Neoformans na spore sa imuhang soil. Alright? Enriched with pigeon droppings. Okay. Now, CNS infection, secondary to hematogenous and lymphatic spread from pulmonary symptoms. So, ang pulmonary cryptococcosis is again similar to pneumonia, bilateral, all right? So both lungs ang involved. But again, the most important clinical presentation of cryptococcosis is sa brain. It causes cerebromeningeal meningitis or again, cerebromeningeal na disease, all right? Ayan. Now, it can be fatal if left untreated, all right? Now, cryptococcomas or parenchymal lesions inside the brain, uncommon siya in C. neoformans pero common siya in C. gatii. All right. Now, cryptococcosis can also be disseminated, and it can present as ocular infections, osseous or bone lesions, and prostatic involvement. And it's believed that in the prostate, muna siya ang mahimong reservoir of infection for cryptococcosis. Okay. So that's for cryptococcosis na disease. All right. Akong allergy shocks. Okay. Anyway, all right. Let's continue. For lab DX, of course, culture of the specimen. Pwedeng blood, pwedeng CSF, depending on disease presentation. Microscope examination of the yeast, you can see encapsulated budding yeast cells. And of course, very important, characteristic colonies of your Cryptococcus, mucoid colonies. Why? Because it is encapsulated. Nako, ayan. Because again, di ba, daghang similarities ang encapsulated organisms. Kung encapsulated yung organism, again, the colonies are mucoid. Aside from that, unsa na disease iyang gina-cause, meningitis, o di ba? Mapa-bacteria or mapa-yeast cells pa na siya, basta encapsulated, unsa same gina sila og mga characteristics, di ba? So same with Klebsiella, pneumoniae, your Haemophilus influenzae, Streptococcus pneumoniae, o di ba? These are all encapsulated. And of course, they are also agents of meningitis, o di ba? And their colonies also are mucoid. Ayan. So if na kay mga case studies po sa exam, and then, na yung mga characteristic dito na mucoid colonies, no? The patient is experiencing meningitis, so ma-isolate na nimo ang organism agad-agad sa choices. Pwede siyang Klebsiella ba kung bacteria or Cryptococcus kung yeast. Okay, basta encapsulated, alright? Mucoid colonies and causes meningitis. Mapa-bacteria ba na siya or mapa-yeast cell? Okay? All right. Now, another method is staining with India ink, of course, or nigrosin. Now, India ink, black background, and of course, the organism will appear as having a halo. Ayan, as you can see. Because again, this halo, by Beyonce, charot. Halo is the capsular, or the capsule, all right? The polysaccharide capsule. Okay? Because again, this capsule do not be stained or cannot be stained by your India ink. All right. So, sige, since we're talking about capsules and I feel like itanong din siya ni Dean, sige, ako na i-ask karon. Your capsules usually, bacteria na siya or yeast. It's akong allergies yun. Your capsules, bacteria or yeast, they are usually composed of polysaccharide. Okay, so that is a sugar, no? Polysaccharide. Now, there is this one bacteria na ang iyahang capsule is made up of protein. Okay, kinsa man yan na bacteria? Sige. And there was silence. It's made up of protein or amino acid instead of polysaccharide. Wait lang. Okay, sige. Laban. Na mo answer or na idea kinsa? Instead of polysaccharide yung capsule, it's made up of protein or amino acid. Hala, crew, yes. Kinsa man? Mer, final answer, anthracis ba? Agree or nailang answer, lain mo answer? Okay. Nailang mo answer? Kinsa man to? Instead of polysaccharide capsule, ang iyahang capsule is made up of a protein or amino acid.
Closer.
Sige, clue. Gram-positive bacilli produces a potent toxin.
Clostridium botulinum.
Almost there. Pero aerobe siya.
Clostridium perfringens, sir.
Aerobe.
Mayroon ba?
Aerobe ba si Clostridium? Aerobic ba si Clostridium?
Bacillus.
Bacillus? Isa man? Bacillus? Causes, o nara. Causes black escar?
Anthracis, sir.
Ayan, press the buzzer. Very good. That is correct, no? Bacillus anthracis, no? Ang iyang capsule, instead of polysaccharide, it is made up of an amino acid. Now, do you know unsa to na amino acid? Sir, wala. Unsa man to na amino acid, yung composition sa iyang capsule ni Bacillus anthracis. Sige, unsa man? Baka itanong ni Dean, at least alam nyo na. Unsa man? Yes, wala pa nabot sa gram-positive bacilli sa reviewer. Sa pagtuon. Ano ta?
Glutamic.
Glutamic. Ayan, galing. Very good. That is correct. D-glutamic acid or D-glutamate. Ayan. So that's the composition of the Bacillus anthracis capsule. That's why it can be deadly. Kaya encapsulated siya and then intense, strong pag yung capsule. Alright? So majority magod of your organisms that are encapsulated, they're made of polysaccharide capsule. But except for B. anthracis, iyahang capsule kay made up of amino acid or protein, D-glutamic acid. Take note of that. Okay. Very good. All right. Don't forget that ha. Baka tanong ni Dean. Okay. Alam nyo na. Magpaunahanay na mo og answer sa side question, Eme. All right. So again, that's for the India ink. Okay. The organism will have a halo appearance. All right. Halo appearance because again, the capsule will not be stained by India ink. All right. So ayan, kanisha. So kanisha ang colorless na area or halo. That is the capsule. Now, this procedure with the India ink is now being replaced actually by an immunoassay method. And that is the immunoassays for detection of the capsular polysaccharide antigen. Okay, so we use latex agglutination or enzyme immunoassay because they are rapid, sensitive, and specific. Your India ink preparation, magod, is quite insensitive or low iyahang sensitivity. Okay, so your Cryptococcus or kanimo ang capsular polysaccharide antigen through immunoassays, they are much more sensitive and specific. Okay, so but again, nagya po yung mga routine labs na mo perform aning India ink preparation. I've tried sa Soto, ikapilag yun nag-perform pero negative ra po siya. So thankfully. All right, ayan, sige. So that's for your India ink preparation and your capsular polysaccharide antigen. Aside from that, all species of the genus are urease positive and the nitrate reaction differs. Okay. So for number 4, the ideas, take note. If na ay question sa exam, all right, sa board exam, sa inyong compre, wherever, ang question kay this organism uses its antigen or capsular polysaccharide antigen as the source of test for diagnosis, inana ang phrasing or inana ang thought. Ang thought kay ginagamit ang antigen for detection of the disease, then press the buzzer. Atong answer ana is Cryptococcus neoformans. Lantawan ni mo ang choices, okay? If mga fungi ang imuhang choices, ang answer na kay Cryptococcus because most of the time the rest of the fungal infections, they are diagnosed immunologically through antibodies. Okay, but for antigen, okay, antigen, it is C. neoformans. So lang tawa ang question. Okay, all right. Now urease, ayan, nako, bacteria na naman. Urease, kinsa mo itong mga urease positive na to? Rapid urease producers. Yes. Hindi pa umabot sa Enterobacteriaceae na pag-study. Okay. Yun sa to, mga rapid urease producers.
Helicobacter pylori.
That is correct. Helicobacter pylori is also urease positive. Rapid urease, good, magaling. Alright. Pero sa mga enterics pala, mga enterics. Mga Enterobacteriaceae, kinsa man to? See?
Fruit juice, sir.
Nagtatanong ka ba? Charot. Final answer, Proteus. Okay, tama. That's one. Kinsa pa tong others?
Providentia.
Okay, magaling. Providentia. And kinsa pa?
Morganella.
Ayan. Wow. Gipakyaw dyan ni Ron, ha? Okay, very good. Magaling. So, atong mnemonics for that, you have ppm. Don't forget, no? Silang tulugin ang magkuyog. Sila ang urease positive. Sila po ang PAD, no? PAD positive. So, don't forget that. Okay? So, urease sa mga enterics. Very good. That is your ppm. Tsakto po itong H. pylori ni Lindsley. Very good. Rapid urease producer po si H. pylori. That is why na I test sa H. pylori na rapid urea breath test, di ba? If you're familiar. Because again, the ability of H. pylori, rapid yun to convert or to produce urease. Okay? So take note of that. All right, very good. Okay, so for the for the fungi, Cryptococcus neoformans are urease positive. Aside from that also, trichophyton, mentagrophytes, di ba, are also urease positive. So don't forget that. Okay. Namatay mnemonics for that actually. It's T-punch, no? T-punch. Tanan na siya. Like T for trichophyton. Nalimot lang kung sa meaning sa P. I think Proteus di ay. Proteus. U stands for urea plasma, urealyticum, okay? N stands for nocardia. C is Cryptococcus. And H is for Helicobacter. Yes, T-punch. If I'm not mistaken, ha, nalimot manggug ko. So, munang wala na ako siya gi-share. Kabasin sa'yo pa akong mnemonics ba? Per T-punch, sa tanan na siya ng organism. Alright, okay. Ayan, sige. Okay, so that's for the biochem of your Cryptococcus neoformans. Again, what you have to remember lang, your dears, are again, India ink preparation, no? Halo appearance, mucoid colonies, urease positive. All right? Okay. And pigeon droppings. So your Cryptococcus neoformans or Cryptococcus species are found in the soil, yun, everywhere, worldwide, no? And must mo proliferate ba yun siya if the soil is enriched with pigeon droppings. Okay? All right. Now, for specific species lang, for Neoformans, again, major cause of opportunistic infection in patients with AIDS. Again, soil contaminated with pigeon droppings acquired by inhalation. It's the most common cause, again, of fungal meningitis. Ayan, and it's found worldwide. Now, again, distinct characteristics. Again, it has a polysaccharide capsule, phenol oxidase positive deers, muna ang enzyme na very important. And the culture media of choice is the birdseed agar. Ayan. And the colonies will be brown to black because of phenol oxidase. Okay? All right. Gram stain, this is from Strassinger. Classic starburst appearance from a CSF sample. Ayan. Classic starburst. So, mura siya ni-erupt na star. Okay? Starburst. Ayan. Urease positive, inositol positive, nitrate negative, and cycloheximide susceptible. For Cryptococcus gattii, as you can see, dears, it's more associated with eucalyptus. No? So, mga areas na eucalyptus, common, possible dito gikan ang C. gattii. But there have been studies na a lot of plants can also be involved. Okay? Per one of that is eucalyptus. And another difference is that instead of affecting only the immunocompromised, it can also affect the immunocompetent patients. And more severe imuhang CNS sequelae because of granuloma formation. Ang C. neoformans judears is primarily yun. It's an opportunistic pathogen, meaning ma-affect ra gyud ang immunocompromised. But for C. gattii, pwedeng both, no? Immunocompromised and immunocompetent. For distinct characteristics, actually, C. gattii and C. neoformans are difficult to distinguish from each other because they have similar characteristics. No, they have also phenol oxidase encapsulated po siya. But one of the important biochem is that your Cryptococcus gattii uses glycine as a source of nitrogen, and we detect that using this agar, canavanine glycine bromthymol blue agar. Okay, so later, towards the end of the lecture, we have a discussion on the culture media of mycology. Okay, all right. And another one is cycloheximide resistant C. gattii. Okay, all right. So that's for the biochem and distinct characteristics of the two species. Okay, so take note lang, Jude dears. Basta Cryptococcus, phenol oxidase positive. Ayan. Birdseed Niger agar. Okay, ayan. And then you have Cryptococcus gattii, again, cyclohexamide resistant. Okay? All right. Ayan. Don't forget that. Okay. Sige. Pigeon dropping sa muhang soil. All right. Now, the remaining mga yeast-like infections, your Rhodotorula species. Ayan. Rhodotorula species, again, emerging infection or emerging pathogen po siya, implicated as a cause of central venous catheter infection. And very important characteristic lang yun, dears, kayahang colonies. No? Carotenoid pigments produces pink to red or bright salmon pink na colonies. Ayan, nasa picture. Okay, salmon pink, red, pink to red colonies. Ayan. And of course, encapsulated po imuhang yeast cells, urease positive po siya, and some species are nitrate positive. So, different na siya sa nitrate reaction. Okay, so same na siya with bacte, mga bacteria na nice mga biochem characteristics. Okay, ayan. So again, very important thing to note with Rhodotorula, carotenoid pigments ang colonies, bright salmon pink, all right, or red to pink colonies. Okay. And next, you have trichosporon. Again, we discussed about trichosporon, but again, it's an important yeast infection. It's known as the most common cause of non-candidal infection. No? So, if na mga yeast infection na dili candida ang cause, it's trichosporon. Siyang pinaka-common. Alright? And we have different species, T. asahiae and T. mucoides, deep invasive infections, T. asteroides and T. cutaneum, superficial skin infections, T. ovoides, white piedra, and T. inkin, white piedra also. All right, and it can also cause chronic hepatic trichosporonosis, and it can also lead to fungemia, no? So pwede siyang ma-spread sa blood. For characteristics, na siya pseudohyphae, na siya true hyphae, na po siya blastoconidia, and na po siya arthroconidia. So here's an example. Arthroconidia, di ba? Rectangular, barrel shape. Ayan. As you can see, nag-fragment sila from each other. Okay? Barrel-shaped, rectangular shape. So, meron siyang mga train, actually. Okay? Alright, ayan, sige. That's for your trichosporon species. And the summary for all the yeasts na itong na-mention, ayan. As I mentioned, diba, we look at cornmeal twin 80 agar. We look at the different characteristics. So, among the rest, kinsa rin ay arthroconidia, C. trichosporon. Okay, pseudohyphae, mga candida, except for C. glabrata. As mentioned, germ tube positive man, C. albicans and C. dubliniensis. So one of the ways to differentiate the two, we look at the growth. As you can see, C. albicans can continue growing at 42 and 45 degrees Celsius, but for C. dubliniensis, negative na siya. So if ikaw makakita kag germ tube positive na sample, you may incubate it after at 42 or 45 degrees Celsius. If na siya po'y growth, imuhang organism, sa 42 or 45, then that could be C. albicans. Pero if wala na siya growth, then that is C. dubliniensis. Okay? Alright. So, ato siyang dispeziate ang duha because silang duha ang germ tube positive, if you can remember. Okay. Now, urea, of course, Cryptococcus and trichosporon ang positive. For nitrate, ang Cryptococcus na positive kay si C. albidos or albidos. Cyclohexamide, again, susceptible si C. neoformans, resistant si C. gattii. Alright, so that's for the summary of your mga yeasts na itong na-mention. Alright, so before I proceed to the remaining topics na lang for today, do you have any questions, dears? Any clarifications? Buwan ko sa allergies, shucks. Okay, anyway. Alright. So don't forget the mga side questions, ha? Dako kong feeling yun mo question po si Dean Rodriguez sana. So, at least press the buzzer agad-agad. Okay? Alright. Okay. Basta black escar, no? Bacillus anthracis, capsule is made up of D-glutamic acid or D-glutamate. Don't forget that. Okay. Alright. Any questions? Okay. All right. So we continue now with the remaining na lang. We'll start first with pneumocystosis. So again, this is caused by Pneumocystis carinii or Pneumocystis urevetsii. All right. Now, I've mentioned this sa atong protozoa pa lang na discussion sa para. It was originally first classified as a protozoa, but through morphological identification and molecular techniques, no, it is now classified as a fungi. No, so it's still fungi. It's now a fungi. Pero ihang stages pa rin, dears, are similar to your protozoa. So as you can see, na siya trophozoite, na siya cysts, and na po siya pre-cyst. Alright? Now, your P. carinii ang gikan sa rats and P. urevetsii ang mucous og infection sa humans. Now take note, this is the most common opportunistic infection among individuals with AIDS. Mugyo ni siya, dears. And usually mga AIDS patients na to, they usually die because of pneumonia, all right? And they die of pneumonia caused by Pneumocystis carinii or Urevetsii. So, mudyo na ang pinaka-common opportunistic fungal infection of your AIDS. All right? So, it's a typical fungus that causes infections, again, pneumonia, in the immunosuppressed na mga patients. So, it causes pneumocystosis or also known as PCP, Pneumocystis carinii pneumonia. So, kung siya si PCP, kinsa may makakos sa PAP, primary atypical pneumonia. Yes, bagal. Primary atypical pneumonia, PAP, kinsa may nakakos ana.
Myco. Something.
Kinsa?
Myco.
Ay, parang humina. Myco?
Plasma.
Sige. Kinsa man ni? Magpakilala ka. Who is si?
Vanessa, sir.
Vanessa, okay, go Van. Sige, unsa man?
Katong mycoplasma daw.
Mycoplasma, unsa may species? Ha?
Pneumonia. Mycoplasma
Okay.
pneumonia.
Very good. Magaling, Vanessa. So ako rin pang take note kasi itong mga nag-answer ha. Kanira, PAP. Sige lang. Okay. All right. Mycoplasma pneumoniae. Don't forget, no? Your Mycoplasma pneumoniae causes primary atypical pneumonia, also known as walking pneumonia. So don't forget that. Okay, very good. PAP, Mycoplasma pneumoniae. For PCP, ayan, Pneumocystis carinii pneumonia, it's caused by Pneumocystis urevetsii or Pneumocystis carinii. Very good. Okay. Now for the life cycle, as you can see, na siya life cycle. Infective stage pa rin is the cyst. Okay? Na siya 3 stages, na siya trough, na siya pre-cyst, and na siya cyst. Okay? Now take note, ihang trough diri dears is not motile. Okay? Di siya pare sa ubang protozoa na ang trophozoite ang feeding stage, di ba? Siya ang motile. But for Pneumocystis, wala na ni siya, no? It's non-motile, all right? Pero it can undergo asexual reproduction. So ang imuhang trophic form or trophozoite, igurang mo divide, okay? And they form duha ka daughter cells, all right? And these daughter cells can fuse together to form to undergo sexual reproduction to form the cyst. Okay, so ang cyst, it is thick-walled and contains intracystic bodies, or some references call it the sporozoites, no? Same sa plasmodium, no? So again, na siya cyst, na siya trophozoite, tapos siya pre-cyst. So as you can see, ang iyahang terminology, same na gyapon sa protozoa. But do not be confused, iyahang terminologies lang ang pang protozoa, but as a whole, this organism is considered to be a fungus. Okay, it is a fungi. All right. Now, for mode of transmission is still respiratory route. It's through inhalation of your cyst. Okay, ayan. Now, the spores or intracystic bodies can, again, and yung life cycle. Sexual reproduction also occurs. Ayan. So as I've mentioned, kaning life cycle dali. Okay? So different stages of your pneumocystis ang pwedeng makita sa imong sample. Na trough, na cyst. Okay. All right. So for the disease, of course, it starts first with the lungs. Ay, asan na to? Ayan. So, of course, it starts first with the lungs. If immunocompetent lang ang patient, asymptomatic. But for immunosuppressed patients or immunocompromised, life-threatening symptoms can happen. Okay? Pneumonia ang first symptom, all right? The most common presentation. And from there, pwede na siyang spread to the other organs, no? Through hematogenous or lymphatic spread to the other organs in the body. Especially seen in patients with AIDS. All right? Now, for pneumonia, ang ihang pneumonia kay interstitial, so in between or sulod sa lungs, na yung mga infiltrates. All right? Composed of mononuclear cells and mga plasma cells. All right? Now, radiographic evidence na ay ground glass appearance, ang iyang appearance sa pag-X-ray or CT scan ba? And for histological appearance na ay foamy exudate. And aside from that, there is non-caseating granuloma and infarct-like coagulative necrosis. So take note sa histology, remember, different types of necrosis, different types of granuloma. So for non-caseating, it means ang imuhang granuloma kay na essential necrosis pero ang iyang appearance overall more siya dili cheese, no? Kaya ang opposite sa non-caseating, caseating granuloma. Ang caseating granuloma, iyang appearance kay murag cheese, okay? So that is usually seen in tuberculosis, 'di ba? Ang caseating granuloma. And for coagulative necrosis, different types of necrosis, 'di ba? Coagulative meaning nigahi siya, no? Dry, hard, no? Because of coagulative proteins, no? So nag-necrotize, usually due to infarction. So meaning na ay blockage of oxygen supply to your organ. Okay? So na infarction. Okay? Coagulative necrosis, mugahi ang part sa imuhang organ or tissue. Okay, so take note, na siya sa histo. Different types of necrosis. Okay, all right. So that's for pneumocystosis. For diagnosis, of course, microscopic examination of your sample. And usually itong sample kay lower respiratory tract specimens. So your sputum, you have bronchial brushing, transbronchial or open lung biopsy specimen, and of course, BAL. And the specimen of choice is, of course, bronchoalveolar lavage. Okay. And of course, we then process it histologically and use mga stain such as Gomori methenamine silver, GMS, or Grocot methenamine. Ayan. Grocot Gomori methenamine silver. Gemsa, PAS, toluidine blue, Colcofluor white, and immunofluorescence. The stain of choice, dears, is your Gomori methenamine silver. Okay? Grocot or Gomori methenamine silver. For Gemsa stain, ang yang stain ra kay ang cyst, okay? Ang inside sa cyst, all right? And it can also demonstrate the trophic forms. Ang Gemsa, ang makita sa cyst kay ang intracystic bodies, okay? And the cystic bodies are arranged in circular yung arrangement. For GMS, your Grocot methenamine or Gomori methenamine, the cyst will be stained black, yahang wall. All right. Immunofluorescence, again, both the cyst and the trophic forms can be stained. For calcofluor white, mofluoris o blue-white color when viewed under UV. Okay, so that's for the different stains. So here's an example. Ayan, Gemsa. As you can see, this is the cyst, kaning circular arrangement sa tunga or sa sulod, that is the intracystic bodies. Okay, arranged in circular arrangement. And then this is the Grocot's methenamine or Gomori's methenamine. As you can see, the cyst are stained black. Okay, iyahang cyst wall kay color black. Okay, stain of choice pa rin for pneumocystis is of course Grocot's methenamine. Okay, or Gomori's methenamine silver. All right, so take note of that. All right, so that's all for the opportunistic mycoses. So remaining topic na lang before we end. Gamay na lang yun. All right, any questions, dears, before we continue? We're almost done. Okay. All right. Sige. All right, so we continue now with your fungal and fungal-like infections of unusual or uncertain etiology. Okay? So again, number one is your Adias pyromycosis. So kani sila ng mga diseases, dears, usually, they are not common and also they are difficult to culture in vitro. So munang sometimes unusual siya na mga pathogens. All right? So example, Adias pyromycosis caused by Emontia species. So ang yahang disease presentation is more on granuloma formation, no? Granulomatous lesions from different areas in the body. For morphology, again, siya Adaya conidia or a spherule. Ayan, siya mga spherules, but ang sulod sa spherules na ay eosinophilic globules, as you can see, orange siya, and wala siya endospores. So muna siya different sa spherules niya sa Coccidioides immitis. Because your Coccidioides immitis, di ba, they produce also spherules. Pero ang sulod sa spherules sa imuhang Coccidioides immitis, they have endospores. For Adias pyromycosis, Emontia species, wala siya endospore sa sulod. So wala na siya, maghalo na siya. Naray mga globules, alright? And eosinophilic sila. Okay? Alright, so that's for Adias pyromycosis caused by Emontia species. Alright. So Emontia species is also a dimorphic fungus. Ayan. Yes, so that's for Adias pyromycosis. Next is Lacaziosis or lobomycosis caused by Lacazia loboi or Loboa loboi. So again, it causes yan, mga lesions, no? Tumor-like lesions or keloidal na mga nodules. Alright? Again, dili ra mo involve ang mucous membranes or internal organs. So walay systemic dissemination. In morphology, as you can see, chains of budding cells, no? Na connected by bridges, narrow bridges sa tunga. Alright? And that's for the morphology. Again, identification is through biopsy, histological biopsy. Okay, all right. So that's for Lacaziosis or lobomycosis. This is normally seen in humans. Again, aside from humans, it can also be seen in dolphins. Okay, mga dolphins, this is a normal infection by dolphins, ang Lacazia loboi or Lacaziosis. All right. And the last is rhinosporidiosis caused by Rhinosporidium siberi. So it causes, again, mga lesions, gyapon, tumor-like polypoid masses, usually seen in the nasal, in the nose, and also conjunctiva. So there could be nasal obstruction and bleeding because of polyp formation. All right. Now again, very important lang, iyahang na siya sporangia, and inside the sporangia na siya endoconidia. And the endoconidia are distributed in different zones. Okay, so na picture later. Okay, and for trophozoite is the baby or the smaller cell. It then becomes endoconidia when it matures. Okay. Sorry, from endoconidia pala, dito magikan ang trophozoite. Okay? Alright, ayan. So here's a picture. This is your rhinosporidiosis. Ayan, polyp formation or tumor-like masses sa nasal, sa nose, and you have conjunctiva sa eyes. Alright? And this is what we call katong zonal distribution. Ayan. The endoconidia deers, ayan, munish sila. Ang sa outer, crescent shape, mga immature, ayan, nasa outer. And then once you go inner, muna siya mga mature na endoconidia. So muna siya pasabot sa zonal distribution. So na ay zones, no? So ang outer, ang immature, and then ang inner, ang mature. Okay? So crescent shape, di ba? Crescent shape ang imuhang arrangement. Okay? Alright. So that's for rhinosporidiosis or Rhinosporidium siberi. Okay. Ayan. All right. And the last topic for today, dears, are the mycotoxins and mycotoxicoses. So by the name itself, again, mycotoxins are secondary fungal metabolites, all right? Mga byproducts of fungi na once introduced into food, in the environment, or inhaled by people or by us, no, it can lead to severe infections, all right? And usually it can be acute. If acute infection, it can lead to death. Kung chronic mangani, it can lead to cancer, okay? All right. And usually the most common mode of transmission is through ingestion of contaminated food. But aside from that, pwede po siyang direct contact sa food, all right, or sa fungi, or inhalation also. But the pinaka-common good is ingestion of contaminated food. So ato nang emphasize ang pinaka-common, of course, number one is aflatoxins. Ayan. Again, prolonged exposure, constant exposure to low dosage of aflatoxins have higher risk or is correlated, no, to increased risk of developing hepatic cancer, hepatocellular carcinoma. So aflatoxins, kinsa nag-produce ana? Aspergillus flavus, Aspergillus parasiticus. Nasa makuha, again, from peanuts and cereal grains. Ayan, okay. Next, you have ergot alkaloids. Ergot, dears, is a fungal mass found in food. Okay? And this fungal mass produces mga alkaloids or mga toxins po. And dito siya nato makuha. So asa, mga rye, cereal grains pa rin, and it's produced by Claviceps species. Alright? It can be gangrenous or convulsive. So gangrenous na ay vasoconstriction sa tissues, sa extremities. For convulsive, it involves the brain. Alright? Another one is your ochratoxin. Alright? It causes your Balkan endemic nephropathy or BEN. Ayan. So cereal grains, it's produced again by Aspergillus and Penicillium. It leads to chronic nephritis. Another one is trichothecines, which causes kaning alimentary toxic aleukia or naay leukopenia, dears, naay decrease in white blood cells produced by cereal grains, and this is from the fungus Fusarium. So there have been outbreaks of this before sa World War II, aning ATA. So because of naka-ingest sila og cereal grains or bread na naay fungus or naay toxins sa mga Fusarium species. All right. So the rest, dears, are again familiarized lang with the toxin, kinsay nag-produce, and then the possible clinical presentation. So summarized version lang sa mga mycotoxins. Okay? So mycotoxins, again, these are fungal metabolites that are incorporated sa food accidentally because of poor food handling and storage. Okay? And once makaon na to, it can lead to severe symptoms. Okay? Mycotoxins and mycotoxicoses. All right. Okay. And that's all, ayan, for today. Okay? Before we end, do you have any questions? Okay.